Hi folks, my name is Ezzy. I'm the creator at Healthcare Sumo and also a product manager in health tech. In addition to the tools I'm creating at Healthcare Sumo to help consumers understand and choose the best insurance plan, I've also gotten a lot of questions about a few developments in healthcare, in particular the Transparency and Coverage Act. I wanted to do a deep dive video into what the Transparency and Coverage Act is all about, and also do a deep dive into what the data looks like. When I was curious about it, I didn't see too many deep dives of what this data actually looks like, probably because the data involved it requires a supercomputer to actually analyze. So I'm happy to do this video to start conversations around what data has been opened up to us with the Transparency and Coverage Act and what we need to do better moving forward to help the data become useful across all parties. One note here is that the Transparency and Coverage Act has two areas of focus. One of them focuses on payers, where payers need to publish their list of prices. But there's also a second part involving hospitals, where you'll start to see hospital websites also have lists of files, lists of prices that are required to be publicly posted. But this specific video is going to focus on the Transparency and Coverage Act for payers, and it's going to have an accompanying blog post as well. So why should you, well, let's start with a disclaimer. I am not a legal authority, and this is not legal advice. It's for informational use only. So please refer to the proper sources uh, for legal advice. All right. Why should we care about the Transparency Act? One thing that has always stood out to me in healthcare and how frustrating it's been in my experience is it's wild to me that you can walk into a Best Buy and you know the price for a television you want to buy, but if you walk into a doctor's office, typically the prices are not very clear. And when you ask the doctor, they say, I'm not really sure. I can't tell you that. Go call your insurance company and ask them. It is perplexing to me that we're paying for our livelihood and our health, but we don't know what the price is going to cost before we go in for treatment. And much of the time with high deductible insurance plans, we need to know the price beforehand. Otherwise, we're going to be footing very large bills, and the price actually makes a difference in terms of what doctor you might choose, or if you decide to hold off on an expensive procedure here so you can focus on a different doctor for a different problem. Besides this data being helpful for consumers, it helps all parties in some way. If you're a doctor and you own a practice, you have negotiated rates for all of your services with an insurance company. If you're at the dentist can get paid a specific amount for a crown that gets put in. With all this data publicly accessible, a dentist is going to be able to understand what their colleagues and other friends that own dental practices are being paid by an insurance company. So it helps negotiate. And this extends to whole hospital systems because when this data is publicly posted, everyone has a clear idea of what prices are being charged for services across the board. This also helps payers in a similar sense because if you're a United Healthcare or an Aetna, you know what different insurance companies have in terms of partnership agreements and negotiated fees across different um, hospitals. And this can help you negotiate as well and find fair prices. It also helps everyone, including self-employed insurers, because if you have an understanding of different prices and what the landscape looks like, you can better inform your plan design, you can better inform how you think about healthcare and treatment in general. Let's start with where to find this data. Even though this law requires the data to be publicly accessible on payer websites, it's actually really tricky to find. And when you find the data, it's pretty confusing how to find the specific data you're looking for. I was looking for an insurance plan that I had in the past called United Healthcare Choice Plus, and I'll go through an example of how to find the specific rates for that. I was able on Google to Google United Healthcare transparency and coverage, and they were really nice about this. They provided a easy to find web page. I think it's a little bit confusing here because once you get on the web page, you'll see hundreds of different files for employer group plans and TPA plans, etc. But if you search for United Healthcare, you'll see a few indexes here, and these are the rates for United Healthcare plans specifically. And if you open one of these files, you'll be able to see the corresponding locations and links to download the data that you need for in-network and out-of-network files, so that actual data that you're looking for. Let's talk about what data is available. This is the most exciting part because when I discovered the data that was included, the sheer magnitude was extremely surprising to me personally, and I think it's going to be extremely beneficial for everyone. The insurance companies are supposed to list all the prices per procedure for each of their insurance plans. So if you had United Healthcare, they have many plans underneath. They need to post these rates per plan. And even within that, they need to post the rates per provider. So if you're in New York City, you're going to see the NPI's tax ID numbers, place of service for each fee. For example, if there is a therapist in the Flatiron District, you're going to be able to see this is their NPI, might be a group NPI, this is their tax ID, this is the place of service, and this is the specific rate for this specific person. And in terms of what's included here for each provider, you have two things. One is, of course, the in-network negotiated rate. So if you go to an in-network psychologist, they have some contracted rates with the insurance company. If you're in-network with the insurance company, these, of course, are posted. But also was a exciting find is that out-of-network rates are also mandated. This means that insurance companies need to look across historical claims to reveal what the prices look like for out-of-network as well. And they have to reveal the out-of-network prices in two ways. They need to reveal it in terms of what is the max amount that a plan will pay for a specific procedure, and then also what was the total charge by a provider in the past for that specific procedure. So it's two ways. It's what the maximum amount the payer is willing to pay, and the maximum amount that a provider has billed to an insurance company. This is very helpful if you are going to out-of-network doctors and you're trying to shop around to find cheaper doctors. Now let's do a data deep dive on United Healthcare Choice Plus specifically. A couple fast facts here are that the data was over 120 gigabytes in one file. It's very large. It included rates for over 17,000 different services, drugs, etc. And there are 1.4 million, 1.4 million unique NPIs in the data. What does the data actually look like? This may surprise you. Let's dive into it. What we see here is that there is a provider with many provider groups underneath. There are two provider groups. One has Dr. Joe, Dr. Amanda, and then another provider group within that, Mercy Pediatric Group. And then there's a second one with Dr. Lisa and Dr. Young. In terms of the negotiated rates, you can see that they've listed negotiated rates $140 and $95 for a couple different mental health CPT codes. One thing to note here is that these prices are for this entire bucket of providers, meaning that you might have a hospital or provider groups within the hospital, and you're only going to see the negotiated rates holistically for that whole bucket rather than a breakdown of that rate per specific provider like Dr. Joe, Dr. Amanda. This causes problems, but we'll dive into that later. What are some of the main challenges that I faced when I started looking at the data? These are the main challenges I faced. So I'm very curious to hear what other people are seeing and what we can do to improve the data. And to show you and illustrate all of these obstacles, I'll walk you through some actual examples of the data that I was looking at. First, some background. I was able to look at data for United Healthcare, and I focused specifically on one procedure, one service. This was a CPT code for uh, a 60-minute therapy session, and I was looking for the rates for that 60-minute therapy sessions for providers in New York City. Here, this graph looks kind of nuts, but it's very simple. The main thing you see here is the price. You can see that the general price for a therapy session is $150. And if you look at the horizontal, this is the size of the practice. So we're seeing prices per size of practice, meaning that you see some prices that are 200, and some of these prices are going up all the way to $1,000 for one psychotherapy session. And you can see the practice size increases. In some cases, there is a practice size. This is how the payer grouped that number of providers I talked about on the earlier slide. You see a total, bucket of providers of 2,000 providers or 4,000 providers for this price. Okay, obstacle one is garbage rates. The typical price for that 60-minute therapy session, as you probably know, is going to be around $150. But we're seeing prices here that are upwards to 400, 600, 800. That's wild, right? That's not accurate. Looking at the specific facilities and provider groups, I saw a Memorial Neurology group. I saw Brain and Spine Surgeons of New York City. I saw a radiology group. Obviously, even though this the data I was looking at was supposed to be for providers, mental health specific providers and therapists, a lot of these other groups got into the data somehow. And I think what's happening is that there are broad contracts, or maybe um, one of these providers is actually a therapist, but it's bucketed incorrectly. But you can see here we have numerous examples of garbage rates here. There's no way a therapy appointment is going to be $800. So it is really important to filter out for data points that are outside outliers. Another challenge is vague provider level prices. This is the same graph on this page, but you can see that there is one fee that was associated with Weill Medical College of Cornell that had a bucket of over 1,500 providers. This means that uh, this price here, I think it was around $350, was linked to a bucket of 1,500 different providers. I don't think there's any way that this could actually be a accurate price across 1,500 providers because the price of therapy is going to vary across many factors, including the credentials and the individual provider negotiated prices. In my research, I wasn't able to determine that individual provider level prices were included. Instead, it looked like all of the prices for a hospital were associated with a whole bucket of a large number of providers. And I think that creates some challenges. In smaller practices of 10 to 20 providers, the price is going to be highly accurate. But if we're looking at large hospital systems and the data is bucketing all of these providers, and there's no easy way to understand what the specific price for an actual, Dr. Nancy that you want to go to is at a hospital, this creates challenges as you would understand. Challenge number three is the unavailability of helpful data for providers. In order to make use of the payer data, I had to link three data sets to it. One of them was a taxonomy data set to understand the different taxonomy codes and groups. I also had to link the CMS provider data catalog to get an idea of what the actual facilities were that were listed in the payer data, because all you're seeing is NPIs and taxonomies. You don't know the location of the practice, you don't know what the location facility is, etc. And I also had to link the CMS NPPES provider data file, which has a lot of useful information because it's the predominant file for NPI self-reported data. That includes everything from the taxonomy of specific providers, their credentials, are they a nurse practitioner or an MD, and then also the location they're registered at and their practice location. All of this was helpful data to put on top of the United Healthcare payer file that included the prices, NPIs, TINs, and provider groups. And once all of that was stitched together, that helped me filter out data points to get only providers in New York City because that's what I was looking for, and also get an idea of a lot of these garbage rates I mentioned that were providers that shouldn't have been included in the rate file. This is a large problem. The data files that I found and used for United Healthcare Choice Plus, the data file in one single file was 120 gigabytes, meaning most computers cannot handle this data or make use of it. In addition, it was in a JSON file, so pretty hard to sift through and split up. And hopefully, this will be improved in the future. But the thing here is that payers are only mandated to publicly publish these files on their website, and they're not necessarily available in byte chunk pieces via APIs. And on top of that, the files cover rates, but they're refreshed every month. So if you go to the website in December, the data from November is going to be inaccessible unless you've downloaded in the past. In addition, another problem you'll see is that not all the files include all the required fields or the specific values that you would expect, but there is a new extension to this law that starting in January 1st of next year, we're almost there, the payers have to meet a specific file format that CMS has dictated, and that's either in JSON or CSV, and they have listed out all the specifics on structure. And you can actually click on the link here to CMS's GitHub repo, where it shows you all the required fields and helpful descriptions to understand what kind of data needs to be included. When I was able to address all of the challenges I mentioned, I finally got to a place where I had a few thousand therapy providers in New York City that had a fee for the 60-minute therapy sessions. And this is what it looked like. Here you can see that when we're looking at practice sizes of between 0 and 100 providers, the rate for a 60-minute therapy session trended upward depending on the provider size, and it varied from $136 all the way up to $160. So this paints a picture of how useful this data can be. Imagine having these data across over a few thousand different procedures, medicine, etc., across locations, across demographics, across providers. The fact that this data is all publicly available will really help us paint a picture of the healthcare landscape in a way that was difficult before. Previously, you would look at maybe proprietary claim data or any data that was mandated from Medicare plans specifically, but this covers the whole commercial landscape of data, and I'm really excited to see what everyone is going to build with it. And I'm extremely excited to see what people are going to build for consumers specifically, because this is an opportunity to break out of the sphere of only being able to ask insurance companies how much different prices are. With all of this data publicly available, I'm hoping to see some emerging players that are going to help make this data useful for end consumers, where anyone on Google that has access to the internet is going to be able to shop for the best prices and actually have an understanding of what prices are and make that a factor in their selection of doctors. I'm going to post this data set if anyone wants to play around with it. Specifically, I'm going to post a data set with 2,600 provider groups in New York City with the rate for a 60-minute therapy session. I linked this data set across the NPPES taxonomy and as well the CMS facility information. So for each of the provider groups in the United Healthcare data set, you'll be able to see the data that was included there, but you can also see some specific helpful demographic info like the facility's location, the number of providers, etc. If you're interested in doing more of a deep dive yourself, I would definitely check out the accompanying blog post that I plan to add here. The CMS website has a pretty good overview of what all of this looks like, and there are also a couple commercial startup companies that are making this data available. Turquoise Health has done a pretty good job of creating some dashboards and a search on their website where you can search through prices for a specific procedure you're interested in without a supercomputer. And Sarah of Health, I've also seen some great blog posts from them doing deep dives into areas that they think that need to be improved in data quality, and also the challenges they faced in accessing the data. That's all I have for you. I hope you enjoyed this talk. And as I mentioned, this is to kick off discussion in the space and help everyone learn more about the data available in the Transparency Act and where it can go. I encourage you to reach out if you have any comments or learnings you'd like to share. And I'm also happy to pool resources together and help everyone benefit from a shared understanding here because we're all in the same boat in terms of trying to make this data available and helpful to consumers. Thanks for watching.